Okay, so this is a video. I'm just trying to see if I can record like a frozen section tutorial to see if how it's going. So I thought I could just do like a frozen section recording. So I'll start with that, I suppose. So here we have like a piece of tissue, and it's a frozen section that we received some long time ago. And I was thinking maybe I could go through it and walk the viewers through what we're looking at. So, this is a frozen section. For those unfamiliar with this, it's not a permanent section. And from a low power, as we're driving through, we could see that there's some kind of thick muscular tissue. There's also some arteries here. And let's go here. This is some frozen blade artifact. Here's another artery. Here's some sort of surface or some sort of glandular material, and more glands. And then here is some more kind of different interesting things. So let's just kind of zoom in. The first thing of frozens is like, where are we, right? Like where are we? And I think this frozen is pretty straightforward based on normal histology. We have fascicles of muscle, of smooth muscle. Some of them are going kind of sideways with these nice cigar-shaped nuclei. Let's go a little higher power on these. These nice like cigar-shaped nuclei. You can see these nucleoli. They're pretty, benign. And this fascicle is going in and out of the screen, and it's going in like horizontally, kind of coming out towards us. And these are like intersecting uh, fascicles of smooth muscle. And then, like we previously mentioned, there is large muscular arteries right over here. So the reason this frozen was probably sent was because the surgeon is looking at how much, well, they probably know that this patient's got some sort of endometrial carcinoma, endometrioid carcinoma, and they would like to know the extent of invasion. So here we're getting to like the more, I guess, the business side of the frozen section, and here we're seeing the malignancy. There's also an area here that I skipped over that I wanted to show everyone. It's always good to have some normal sections or some normal epithelium of the myometrium. And here, I think this is as best normal as I guess as we can get. It's probably not. This looks kind of maybe reactive, um, but you know, compared to what we're seeing on this area over here, that looks a lot more low grade on the previous area. Here it looks a lot more higher grade. So maybe let's go on 10x and kind of look around a little bit. I think the area here is, we're seeing these glands that are back to back. There's no intervening stroma here, and they're infiltrating into the myometrium. So right away, the thing that comes to the top of our minds, like look at this gland going into the myometrium. The thing that comes to the top of our differential is this an endometrioid um, carcinoma? And that is the most likely thing here, because our other options is this primary, or is this metastatic? And things don't really metastasize to the uterus that often. And another thing to be on the lookout for is clear cell endometrioid carcinoma. But this looks like it's more conventional endometrioid, probably FIGO grade 1, like pretty well differentiated. And let's just take a peek again. You have these like nuclei. Look at these nuclei. They're pseudostratified. They're bizarre. They're going on top of each other, and these glands are dissecting into the muscularis. Oopsies, into the muscularis mucosa. Sorry, oh my God. Sorry, that's my GI training coming through. They're kind of dissecting into um, the smooth muscle right over here. But you can see there's a lot of smooth muscle here, and the invasion is less than it's like maybe 10%, so it's less than 50% of the smooth muscle is involved. So, if we were to sign out this frozen, we could say, like, I mean, there's a lot of ways of saying this. You could say positive for malignancy, um, endometrioid carcinoma is present, less than 50% of so depth of penetration, like around 5 to 10%, however deep that is. So that's good news for us, I guess. That's how we could sign out this frozen. And then let's look at some more pictures that I took. So here's the gross image, and you could see here's one of the ovaries. Here's the uterus opened up, and you could see like it's bivalved. And here is like some sort of kind of rough area, which is probably where they took the frozen section. This was probably where the frozen was taken. You could see it's kind of like fungating area extending from the fundus kind of more into the endocircle canal on one of the sides. And from low power, this is what we got from low power, and our area of interest was right over here. This is where we were interested in. And then this is the area that of the specimen that we looked at that had more. I think this is benign glands. They look kind of atypical to me. Maybe they're low grade, like hyperplasia without atypia, I think. Um, but I wouldn't like get too stuck up on these because the more higher yield area is the other part that we were looking at, where the glands were back to back. Like you could see the glands are back to back and they're dissecting through the um, smooth muscle. And if we go on another picture where we have more higher power, you could see there's nuclear clearing, nuclear pseudostratification. They lose their architecture and they're kind of pushing right into the myometrium. Right over here is a good example. You have like some pushing invasion, you have some kind of angulated gland invasion. So, the question is like, what's our diagnosis here? Is it endometrioid carcinoma, hyperplasia without atypia, disordered proliferative endometrium, atypical polypoid endomyoma, or complex atypical hyperplasia? And the answer here actually is, unsurprisingly, it's endometrioid carcinoma, and we are basing this on the fact that there's loss of intervening stroma, there's confluent growth, cribriform growth, or complex maze-like epithelium. There's also regular infiltration of the myometrium, which we saw, and unfrozen, I don't think it's that easy to see altered fibroblastic or desmoplastic response. You can sometimes, but it's a little hard. We saw it's also solid non-squamous epithelial growth. We have that, and there could be different architecture. Regarding like frozen outcomes, like what does it mean when they do this frozen, when the surgeons sent for this frozen? A lot of factors can determine how aggressively surgeons are how they cut for like lymph node dissection. So, but like a lot of factors determine this. But if the depth of invasion is greater than 50%, they will that will upstage the tumor. So they are more likely to do lymph node dissection in those cases. And then there could be like questions like radical hysterectomies. That's more used when the cervix is involved. So in our case, even if it was greater than 50%, they may not convert this to radical hysterectomy. Actually, they probably won't. And that's either because it's a cervical primary or because there's endometrial cancer that involves the cervix. There's also something called modified radical hysterectomies, which can have smaller amounts of vaginal or parametrial tissue. They can take small amounts of those, but they can have some vaginal cuffs, and that's sometimes grossly like you'll see that on the gross room, but that's mostly because they're trying to make things fit back right, not because there's disease factors. So the frozen section diagnosis for this case was well differentiated endometrial carcinoma and less than 10% invasion of myometrium. The final diagnosis for this case was endometrioid carcinoma, grade 1, PT1, and it was limited to the myometrium, meaning that invades less than 50% of the myometrium. And here's some additional readings for those interested. Thank you so much for listening. Please don't forget to like and subscribe, and I'll try to make these kind of videos for frozen sections more routine. Thank you, everybody. Goodbye.